Good morning, everybody. Anybody not hear me clearly? Okay. I'm Dr. Hoffman, and we're going to spend just a few minutes talking about how to keep you safe with all the sun exposure you're getting this time of the year. A lot of years ago, industrial places like this were very dangerous places to work. On the average year in a plant like this, you would have 10, 20, to 30 men dying from industrial accidents, thousands getting injured, arms, legs, so on. So people came up later and said, listen, we can make this a safer place for the guy to work, for the gals, and still get the job done. So they came up with all the safety devices that you're familiar with now. Granted, sometimes it's a little overboard, but it's the idea that counts. Similarly, when you're on your own time, this coming weekend, everybody's going to be out doing picnics, doing trips to the lake, going to the shore, this kind of thing for your vacation holiday. Good idea. But at the same time, you can get hurt just from too much sun exposure. Routinely, what I'll see is folks will come in around the 4th of July, and the two most common things that I'll see is people coming in with excess sunburn. We're at the point where they have to go to the burn center and get cared for, just like any other burn. They'll need, in some cases, they even need to be in the hospital for a few days. Now, you can imagine ruining your work week, ruining your vacation time by being in the hospital. Obviously, that's something we want to avoid. The other thing that we'll see is people obviously had too much to drink, get into accidents, and so on. But the biggest single problem is still people not taking care of themselves when they're out in the sun, because you're indoors most of the time, here at home, so it's not like you're out in the sun all day long. But you still get times both at work and at home when you get a lot of sun exposure. So the key is prevention. The key is trying to understand how the sun can injure you. Obviously, damage any of your exposed skin, damage your eyes. Case in point, a few years ago I was in a country called the Dominican Republic, which is in the Caribbean, doing some humanitarian work. Everybody in that country that was my age had cataracts, in part because it was the tropics, in part because they didn't take care of their eyes. And so consequently, you would see 40 and 50-year-olds walking around bumping into things like this and having no way to treat that problem, because in that country they don't have eye surgeons to take care of the problem. So they would be effectively blind, not be able to work, not be able to enjoy the time off with their family. Tragic and avoidable. So things for you to do to help. Number one thing, taking care of your eyes, some type of eye protection. Prescription glasses if you need them, other kind if you don't. They don't have to be a $100 pair of sunglasses. To some extent, the cheapy sunglasses that you get at the convenience store, get at Dollar General, will be of some help. But for them to help you, you have to wear them while you're outdoors. And people who are not normally attuned to wearing glasses will forget it a lot of times. But particularly on a holiday weekend when you're going to be out a lot, try to get in the habit of wearing some type of eye protection, whatever it is, while you're outdoors. Now this kind of, the clear glasses, they protect you of course from flying metal objects in the shop, but they won't do squat for you in terms of protecting you from excess sun exposure. And the worst exposure is going to be early in the middle part of the day when the sun's the most intense. So that's a time when you want to make sure that you have whatever protection you're using. Obviously, you want to protect your skin. If you have years and years of sun exposure, eventually you're going to develop some kind of skin cancer. Many of you, particularly the older guys and gals, probably going to the doctor's office occasionally getting your skin checked, having mold removed, something like that. It happens. But, again, prevention is better than counter cure. So how to protect your skin? Simple things. A hat. Not terribly high-tech, but it works. Now, a hat like this gentleman's wearing certainly protects your face, protects the top of your head. And you'd be surprised how many people will come in on the holidays and thereafter with terrible, terrible sunburn right on the top of their head. There you go. Particularly when you've got a beauty spot like this gentleman has in the back of his head. All right. And the older you get, the more likely you are to have those, unfortunately. So some type of protection, not just for the top of your head. Again, hats like this, call them what you will, can provide some additional protection for your ears and the back of your neck and the area on your front of your neck and your cheeks. Because the area that most of us ignore when we're out in the sun is the top of our ears and the back of our neck. And what happens then is these are the areas that get sunburned. These are the areas that are highest risk for skin cancer after years of exposure. So ideally, some type of hat that covers all those areas is going to be to your benefit. And you probably have one or two of these lying around the house. Now you say, well gosh, all I have is a baseball hat. That's a lot of help. So anything is better than nothing. That's the way you got to look at that. The other part of protecting your skin is good old sunscreen. Generally, the higher the rating on it, this one's a 50. You can see they're relatively cheap. But you got to put it on for it to do you any good. And again, the areas on yourself, on your children, grandchildren, spouses, whoever you're with, boyfriends, girlfriends. Again, top of the ears, bridge of the nose, back of the sides of the neck. Those are the areas that are most likely to get sunburned. And they say, well gosh, what about my arms? Now you wear a good t-shirt like this, it's going to protect your upper body, that's a help. But if you're out in the sun, the areas that are going to get the most sun exposure are your forearms. So as weird as it might look, a long sleeve shirt that's down and buttoned, particularly if you're out in the woods, will be of some help to you in terms of covering those areas, protecting them from the intense sun. And also too, if you're out in the woods, if you've got a long sleeve like this, more likely that you're not going to get a tick bite or a tick exposure and all the problems that go with that. So long sleeve shirts, short pants are the thing most people wear in the summertime, but again, the longer pants are going to protect your legs. Most of you, if you look at your leg skin, it's quite white because it doesn't get much sun exposure. So if suddenly you go from wearing long pants at work and you're wearing shorts and you're out on the beach, that's where you're going to get sunburned, from wherever the pants stop all the way down to the top of your feet. We had one poor fellow came in a few weeks ago, and the thing that was burnt was not so much his head, it was the top of his feet. They never got any sun exposure, and of course he was out at the beach for a couple of days lying about, and this is what happened to him. And he had blisters that we had to care for several weeks, which of course cost him money, time, all those kind of inconveniences. So this is an area that you don't normally think about, but if you're going to wear shorts and flip-flops or bare feet or whatever you're going to do, you need to take the old sunscreen and apply it to those areas as well. Most people think, well gosh, I'll just put it on in the morning and that'll be enough and that'll be fine. But unfortunately, no matter how good the sunscreen and no matter what the manufacturer tells you, all the stuff's going to wear off within a matter of a few hours. And again, particularly more in children and old people than anybody else. So you're going to want to reapply this several times a day. The newly exposed areas like your skin of your legs and your feet, again, back, top of your ears, back of your neck, front of your neck, bridge of your nose. And this is the #1 area, bridge of your nose, skin beside it, for risk of skin cancer. Now, young men like these, they'll probably don't have it now, they're probably not going to have it the next couple of years. As we get more mature, what we find the risk of skin cancer gets higher. So the more protection you give yourself when you're young, the less likely you are to have it as you get a little older. And the key ways, I mean, you're going to be out in the sun, particularly this time of the year, the key ways is to use and reuse some type of suntan lotion. And again, it doesn't matter what brand you use, it doesn't matter too much what SPF, the sun protective factor, that you use. Higher is better, of course. But again, try to protect the areas that are most prone to risk. Top of the ears, bridge of the nose, any skin that's not normally exposed with what you normally wear on the street. But again, ounce prevention better than a pound of cure. And we're going to leave up the poster so that you all can look at that as you finish up lunch. And it talks about a lot of the same things, but again, to try to be preventive, to try to think about protecting yourself, protecting your family members when you go on vacation here in the next couple of days. Anybody have any questions right now? Gentlemen, ladies? Okay. All right, thank you all very much.